In BC, as in many places, we're seeing increasing rates of sexually transmitted infections over time. There's no easy answer why that is. In part, it could be changing behaviors, but some of the data we have suggests that that's actually not the case. It could be due to, we know that stigma is still a problem. People are sometimes afraid to get tested or afraid to go and seek testing from their doctor or clinic. We also know that many people don't have symptoms, and so that might be reasons why they're not testing as well. So really the approach when you're trying to reduce the number of sexually transmitted infections is that you think about lots of different things, and you're looking for lots of different programs or interventions that can help with some aspects of what the challenge is. And that's where our program GetCheckedOnline comes in, because it's a program that allows people to get tested without seeing a healthcare provider, and it eliminates some of those barriers that people face to get tested. So it works by people going to the website, creating an account, answering some questions like you'd get in a clinic, and then you either print off a lab form or you get it on your mobile phone, kind of like a boarding pass. You take it to a local Life Labs location. If all your results are negative, you get them all online. If they're positive or there's a problem with one of your specimens, you'll be speaking to one of our clinic nurses, arranging follow-up and treatment. One of the things about GetCheckedOnline is it gives people control over when and where they get tested, and a lot of people like that. In a ways, we're kind of giving control over testing to the hands of the patient. No longer is it sort of the doctor's purview or a clinic purview about when people can get tested. And I think that has a lot of benefits for people. Yeah, we have differing trends in STIs. Encouragingly, we've actually seen a drop in HIV over the last couple of years. We had 200 last year. We've seen increases in recent year in syphilis, mostly in gay, bisexual, and other men have sex with men. And we continue to see a steady increase in chlamydia and gonorrhea as well. Ultimately, the best information is that, if you think, if you need to get tested, either because you're having sex or you think you might have symptoms, if you have symptoms, definitely go see your doctor. But if you don't have symptoms, we recommend people use GetCheckedOnline. It's a good way and convenient way to get tested. One of the things we know about GetCheckedOnline is that it really reaches people who need to get tested. So the surveys that we've done and looking at some of our data really shows it's people who have barriers getting to a clinic to get tested, or they're worrying about judgment and discrimination from their healthcare providers. And GetCheckedOnline really seems a solution that works for many people.